Welcome to our Cherished Futures for Black Moms and Babies Collaborative Workshop number 3. I'm Susan Harrington, Executive Director for Communities Lifting Communities, and it's my pleasure to welcome you. This workshop is being recorded, and members of the media have been invited to attend a portion of this morning's session to hear the keynote by Senator Holly Mitchell. Our workshop today has a morning and an afternoon session, and we encourage our participants to stay throughout the day. Our agenda will include the opening keynote by Senator Holly Mitchell. We'll hear findings and a report back from the Black Woman Listening Circle that was held on July 12th and have a group debrief. We'll have a presentation and discussion on medicine, racism, and motherhood. For our afternoon session, we will be focusing on centering equity with a presentation and discussion with Dr. Elaine Batchelor and Tammy Turner from Martin Luther King Jr. Community Hospital, and a breastfeeding equity in the NICU with Breastfeed LA. Our hospital teams will report out on their data intervention selection, and then we'll have a team discussion on additional interventions that you'll be selecting to reduce inequities in birth outcomes and advance equity in your healthcare organization. Now I would like to introduce Dana Sherrod, our Perinatal Equity Manager at the Public Health Alliance of Southern California, and she will highlight our Cherished Futures successes so far, as well as introduce our next speaker. Dana.
Great, thank you so much. Good morning, everyone. As Susan said, I'm Dana Sherrod, and the Perinatal Equity Manager with the Public Health Alliance of Southern California. And I also have the just the real honor and privilege to be the lead of our Cherished Futures for Black Moms and Babies project. So today, it's really a day that we get to celebrate. I mean, I think with everything that's going on, sometimes it's hard for us to pause and just reflect for a second about where we've been and how far we've come in the last 6 months. So actually exactly 6 months ago from today, we met in downtown LA and we started this year-long journey together. And of course, as we all know, it was a very different world, or at least it felt like a different world then, before the realities of COVID-19 sank in and quarantine, and really this global movement that we're seeing now for Black lives. And in the 6 months that we've been together, we have covered tremendous ground. Each of our 5 hospital teams have really taken time to do internal self-reflection by completing an organizational equity assessment. We've talked about the role of various types of data to help us advance birth equity. And we've also looked at the 400-year timeline of the Black experience in this country and how historical policies and practices have had lasting effects on Black bodies and specifically on our birth outcomes. So everything that we've covered up to this point has been directly related to our menu of interventions. And it has really been designed to help our entire group, all of us as a collaborative, expand our knowledge base and the way that we think about root causes of birth inequities, specifically impacting Black mothers and birthing people. So we're really excited because we're looking to each and every person on the line, and I wish I could, see everyone's faces and feel the energy in the room, but we're really looking to all of you as institutional change makers, as community leaders, and the early adopters that are really committed and that will be the ones to create enduring shifts in birth equity here in Los Angeles. So we've come a long way already and we have more to go, but I hope everybody is committed to continuing this process with us. So I want to introduce our next speaker, or I should say reintroduce, because many of you had a chance to meet her at our launch exactly 6 months ago today. So I want to welcome back Dr. Pooja Mittal. Dr. Mittal is a family physician who works at HealthNet as a medical director of population health. She's a member of the leadership team that works to further equitable care through a population health model for all of HealthNet's members. She's a fellow of the California Healthcare Foundation, and Dr. Mittal designed a project to fund community-based doula care through HealthNet Medi-Cal. And in partnership with the Quality and Cultural Linguistics Department at HealthNet, along with other community-based organizations, she led the HealthNet Community Doula Project for African-American pregnant women in LA County. And the project is currently being studied as a model for value-based care in Medi-Cal maternity. Dr. Mittal works at the National Clinicians Consultation Center at UCSF, a national HIV/AIDS and AIDS warm line, where she is recognized as a national expert on perinatal HIV care. She is an adjunct associate professor at Stanford University School of Medicine. And in addition to her clinical work, she's published in the areas of child care, group visits, preconception care, health equity, and perinatal HIV. So with that, welcome back, Dr. Mittal. Thank you so much for joining us.
Thank you for having me. Honored to be here, and it's so nice to see your faces this morning. Good morning. On behalf of HealthNet, I'd like to welcome you to the third workshop for Cherished Futures for Black Moms and Babies. At HealthNet, our purpose is to transform the health of our community one person at a time. And we're really committed to ensuring that women have access to quality care before, during, and after pregnancy. This includes a commitment to health disparities affecting African-American women and children at a disproportionate rate. This work is deeply personal to me as a family doctor, as a member of my community, as a mother, and as a friend. And I know that HealthNet shares the commitment which we've shown through our investment in communities lifting communities and their remarkable work in engaging hospitals, community leaders, and organizations in the Antelope Valley and South LA region to improve the quality of care for African-American women. And we know that in order to improve the health of an individual or community, we really need to engage everyone in the health system. In addition to our collaboration with CLC, HealthNet also launched the Community Doula Project, which Dana just spoke about. And we're really excited to have some of the early data coming out of that project, which is very promising, and are really excited about a forthcoming report that will talk about the structural racism and the difficulties often faced when community-based organizations work together with large entities. And so I think that's going to be a really important finding that comes out of this work. The Cherished Futures Collaborative is doing truly innovative work by ensuring Black women's voices are woven in and elevated in every level of the conversation. And this is what's really needed to really get those systems change efforts that we're hoping to achieve. We at HealthNet and as part of the project are hoping to continue to build upon the statewide momentum from the recent legislation such as SB 464, heralded by Senator Holly Mitchell. And we'd like to thank you again, Hospital Association of Southern California, Public Health Alliance of Southern California, and Communities Lifting Communities team for your efforts to ensure that African-American mothers and babies are given a healthy future. I'm really eager to see our concerted work ensuring underserved communities received quality health care needed to live longer, healthier lives. And once again, thank you all for being here. We're really excited to have this workshop today. And I'd also like to introduce Senator Holly Mitchell. She is a third-generation native Angeleno. Senator Holly Mitchell is the proud daughter of career public servants and is the protege of community leaders who instilled in her a passion for service. Mitchell, who is the mother of a 19-year-old son, has devoted her professional life to creating a California where all children thrive. She continued her family legacy of leadership when she was named the first African-American to chair the powerful Senate Budget and Fiscal Review Committee. And I know that we understand the importance of Senator Mitchell representing our community there. The senator's groundbreaking successes include nearly 80 bills signed into law, These bills focus on improving human services, expanding access to healthcare, defending the civil rights of minorities and the undocumented, and reducing the numbers of children growing up in poverty. In addition to her chairmanship on the Senate Budget and Fiscal Review Committee, she also chairs the Senate Select Committee on Social Determinants of Children's Well-Being and the Joint Legislative Budget Committee. Please welcome me in welcoming Senator Holly Mitchell today to this event.
I appreciate you all. I thank you for the opportunity and want to thank the Hospital Association of Southern California, HealthNet, and the Public Health Alliance of Southern California in partnership with LA County's AIM, the African American Infant and Maternal Mortality Initiative, for launching the Cherished Futures program to close the birth equity gap, to reduce infant mortality in all while improving maternal patient experiences and safety. So I appreciate that. I'm grateful for the commitment you've all made to transforming the healthcare industry, creating a diverse group of professional leaders dedicated to helping my very own community of Los Angeles. I believe we are truly stronger together, which is why I'm proud to share some time with you today, and I appreciate you for inviting me. Social justice and health equity are not common themes, unfortunately, in clinical services, but you all are truly paving the way. Throughout my tenure, not only in the legislature, but as a health advocate working for the Western Center on Law and Poverty, and my years with the California Black Women's Health Project and the National Black Women's Health Imperative, I have fought for health and economic justice with an emphasis on equity and access, in hopes of creating a California where all people can thrive, which includes exposing implicit bias in healthcare and health access. We've done some of this work through the budget process, which I've chaired for the last 3 years, and most recently very proud of our efforts to lock arms to make sure that state funding to Martin Luther King Jr. Community Hospital stayed constant, because we know what a critical role that facility plays in healthcare delivery for the entire Southern California region, quite frankly, but certainly Southern LA County. You know, I'm very proud of, quite frankly, my partnership with many of you on the Zoom today, and my staff, and the work that we've been able to do now for 10 years. It's hard to imagine, it's been 10 years. And again, bringing the lens I have from those experiences I talked about in community and talked about health access. And that's why how we came to Senate Bill 464, the California Dignity in Pregnancy and Childbirth Act, which creates awareness and actively fights the Black maternal mortality disparity in California. And it became law as of January 1st of this year. My goal as a policymaker has always been to expand the safety net and to increase resources for the safety net for all Californians, again, while closing the gap of health disparities between communities. And when I think of health disparities, quite frankly, based on my years with the Black Women's Health Project, I think critically, most importantly, about Black women. As many of you know this data, a Black woman is 3 to 4 times more likely to die in childbirth than women of other races. And we're talking about all Black women from Serena Williams to Beyonce, regardless of socioeconomic status, education level, and physical health. The disparity spans across all Black women. The common denominator is race, none of those other indicators that are typically used in determining health status. Despite the 55% decline in maternal deaths since 2006 in our state, Black women remain at alarmingly high rates of pregnancy-related deaths. And in my humble opinion, Black women deserve better. It's troubling to know that our great nation is the most dangerous developed country to give birth in. And our collective goal is going to change that. Bias, implicit or explicit, should no longer impact a woman's ability to deliver a full-term baby safely or to survive childbirth herself. Again, that was our goal with SB 464. Far too many studies show why Black women are systematically undertreated and dying or injured during childbirth. But one study was particularly alarming to me and ultimately led to me carrying the bill. The 2016 study by the University of Virginia found that in a survey of white medical students and residents, half of them believed biological myths about racial differences in patients, including that Black patients have less sensitive nerve endings, that we have a higher threshold for pain, and have thicker skin than our white counterparts. In another study, we found that hospital quality isn't always a factor in the disproportionate number of maternal deaths and perinatal injuries. LA County data tells us that Black women who have a college degree or more are likely to suffer adverse birth outcomes more often than white women without a high school diploma. With Senate Bill 464, implicit bias training is now required for maternal and infant health providers, while developing a system to collect and publish data on maternal mortality rates and pregnancy-related conditions with the California Department of Public Health, also requiring CDPH to publish morbidity data. Senate Bill 464 challenges all women, but particularly Black women, to be empowered in their own healthcare experience. That was our focus at the California Black Women's Health Project, to empower women to be their own best advocate in relation to their healthcare provider. And so it's also my hope that women through this bill will be trained and understand their power and find their voice and ask their obstetrician, have you gone through implicit bias training? Because I want to increase the likelihood of my survival when delivering this baby. When I look back over many years, the movement has ebbed and flowed in terms of a movement for Black women, by Black women, in terms of advocating on behalf of ourselves. Again, thrilled to have had a history with the National Black Women's Health Imperative, and they have continuously done all they could in terms of training Black women, orienting us to our bodies and our power and our voice, and being a policy presence and advocate for Black women at the congressional level and state legislatures across the country. Again, it was my years working in the legislature as a consultant to the Senate Health and Human Services Committee when I discovered the National Black Women's Health Project then, and was very honored to, several years later, first join the board of the California Black Women's Health Project, and then ultimately become the executive director. And so we are making waves. Change is coming nationwide. Thrilled that this past March, our Senator Kamala Harris, Congresswoman Lauren Underwood, and Congresswoman Alma Adams introduced Senate Bill 3424, the Black Maternal Health Omnibus Act of 2020, to end preventable maternal mortality and severe maternal morbidity in the U.S. and close disparities in maternal health outcomes. Behind each devastating statistic is a partner, a family in pain, children who've lost their mother, and children who will need our assistance. It will take all of us to close the gap and pave a pathway to equity within reproductive justice. We have to guarantee dignified, thorough, and unbiased perinatal care for all women. It's our fundamental right, and for Black women, our very lives depend on it. Thank you very much for giving me an opportunity to just share my perspective and why I felt carrying SB 464 was so important. Appreciate all of you who've partnered with us in this journey. You know, policy making isn't a individual sport, it's a team sport. And so it's staff, committee staff in the legislature, my own staff who helped staff the bill, and all of you who helped make 464 law in the great state of California. I appreciate all of you, and thank you so much for having me.
Thank you so much, Senator Mitchell. We are just so incredibly grateful for your leadership. We are just deeply inspired. And I just also want to add, as a former team member with the California Black Women's Health Project, it also brings me great joy with our shared connection. So I also just want to acknowledge that the leadership that you have displayed just throughout your entire career really has really encouraged each of us who are on the line, who are actively working to create safer, more joyous births. So we thank you, and we are just so incredibly grateful for you making the time to join us. You are more than welcome. We hosted a sister circle in partnership with the California Black Women's Health Project this past Sunday. And we are just about to share the findings and the report out with this group. We understand you are incredibly busy, but you're more than welcome to listen in if you'd like, but whatever works the best for you. And I see that someone does have a comment also.
Someone has a comment, and then I want to make one more comment, and then I'll listen in as long as I can. I have a 10 o'clock with the LA County Delegation Caucus. So let's hear their comment, and then I'll share one observation I want to share with all of you.
That'd be great.
So Senator Mittal, it's Sarah Kilpatrick from Cedars-Sinai, one of the MFM doctors there. And thank you once again. I met you in your office last year at some point. So Cedars is really happy to be involved in this project, and we really appreciate your leadership. The comment I want to make and have your thoughts on is one of the things we're doing at Cedars to implement the 464 for the perinatal staff. We think it should be more than just the perinatal staff. We think it should be for the entire hospital because, of course, pregnant women or peripartum women are not just seen by OB staff. They come through the emergency room, they go into other parts of the hospital. So I think that even better is to push this, and I hope more institutions will do the same thing, is it should be the entire hospital staff. So I just wanted see what you think about that.
Well, thank you very much for that, Dr. Kilpatrick. And let me say, first of all, Assemblywoman Kamlager did carry a bill. She had 3 bills on implicit bias in training, and one of her bills dealt with the entire healthcare delivery system. I honestly am not sure what happened to her bill, to be honest with you, but I agree with you in theory, absolutely. Let me just say that getting 464 passed was a real uphill battle. I appreciate the work that's done there at Cedars, but we had lots of opposition. CMA, I think, ultimately came out in formal opposition to the bill. Lots of issues about who employed doctors and if hospitals could mandate a doctor to take a training, et cetera, et cetera. So we wanted to kind of put a marker in it and begin with this smaller population of healthcare providers who have direct impact on women. I agree with you, women enter through all various doors of your system to deliver babies. But we needed to start where we could start and get through, to work through some of those concerns, some of those technical issues that many advocacy groups had. I will acknowledge that they were legitimate, but we had to start where we start. You all should check in. Again, I'm sorry that I don't know what ultimately came of Assemblywoman Kamlager's bill. Okay, it passed and will be enacted in 2022. So that will create an opportunity for us to have a more global conversation around implicit bias. The comment I wanted to make is I was on a Zoom yesterday or the day before. SB 464 was discussed, and someone asked if, given all we're facing with regard to COVID-19, did I think that we should put a pause on implementing implicit bias? And I said, absolutely not. That COVID-19 has done nothing but scratch off the fresh scab off of a deep festering wound that Black people and Black women and poor people and communities of color have experienced for generations. And so no, while you all must do what you do to deal with COVID-19, even making sure that healthcare providers have that cultural sensitivity during this current public health pandemic is probably even more important than it was beforehand. That question struck me because it never occurred to me that would be an appropriate expectation. And so I just wanted to share that with you all in case there are others who are assuming that we should slow our progress on this work. I think absolutely not. We have to forge ahead in making sure that every healthcare provider understands the humanity of the patients they're treating and performs their duties in that context. So thank you again for the opportunity. I appreciate you.